Hi, all. Thanks so much for joining Making Healthcare Work for You, Different Perspectives and Empowering Solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta, and we're talking about our interview with Dr. Mark Reardon, who is the Chief Quality Officer for UpStream. This was another fun interview, and I think the thing that really just surprised me the most is that I've never thought about the fact that primary care providers don't have any kind of immediate gratification in their work. With surgeons, he said, you go, you fix the appendicitis, and then the patient goes home healthy and happy. And you have that same thing in so many other jobs. Here we do these interviews, we share the videos, we know that people found that conversation to be valuable. But with primary care providers, their work can often take 10 years. And then it's not even that it's necessarily a goal achieved of something happening. It's that something doesn't happen, like a stroke or a heart attack. And so he was talking about how the work that UpStream is doing to support these primary care providers, to keep them in the field doing that, helps prevent that burnout from feeling like, oh my gosh, I have all these demands that I think he said a recent study showed that they would need more than 26 hours in a day to properly do each of the criteria that they're supposed to follow. I think it's really neat that they're focused on that. They're providing data. They do standardized clinical resources within the clinical offices. They have a pharmacist who's embedded into the office and supports the primary care provider. Then they also have the technology component where they're providing the data, and then the financial component where they're making these payments to primary care providers based on value-based care, but they're doing it on a monthly basis, which is also a twist on what other people do. So that's another way that they can show these primary care providers that they are making a difference every day in the work that they're doing by saying, oh my gosh, this blood pressure is better, the A1C is better. And then they were also really passionate about medication adherence. They work really hard to make sure that the patients are actually taking that and trying to stay in touch with them and spend more time with them if they have to go to the home, sending them different pill packs, whatever they have to do to make sure that the patient's actually receiving medicine and taking the medicine, which is an important part. And I never realized that some of the other evaluations on that didn't take into the fact that the patient actually consumed the medication. Apoorv, what did you take away from this?
It's such a complex undertaking as you're talking about it. You just realize how many different pieces have to come together in order for care to get delivered. And then you wonder why the primary care physician is so beleaguered because it's a real challenge. They're getting hit with everything. Why it takes 26.7 hours, according to that study, for them to take care of everything is because not only do they have to take care of the patients that are in front of them, they've got to document and they've got to deal with the insurance company, the billing, they've got to deal with all the phone calls and clarification of questions. It's really an endless job, and unfortunately, many times it feels like a thankless job. So I really appreciate what Mark is talking about in terms of the UpStream model, that they're really trying to combine several different aspects of the care in such a way that it helps the primary care physician feel like, one, they're making more of an impact than they may even realize by averting outcomes that are really critical to them and to their patients, getting paid for it, and so renegotiating the way in which they are living within the system so that it's not on a fee-for-service basis, but they're really getting paid for delivering value. And because they're getting paid for delivering value, they can take more time with the patients and spend more time to build out this team-based care model, so that they're rewarded and their patients' lives are actually improved, and then ultimately have the technology, the resources, and the support to take away some of the drudge work, which they're really not going to ever be able to get to. I mean, there are probably many, many more aspects that are really required because primary care physician practice is truly, really complex. But at least if you tackle and start taking on some of these more critical pieces, then hopefully for the primary care physicians that they're working with, they will truly start to feel an impact, as Mark was indicating. Some of their conversations seem to be indicating. So I wish them all the best in this effort. It's really, to me, feels like the challenge of our times, really figuring out how primary care physicians can really help improve the care of their patient panels without becoming overwhelmed themselves. And I think UpStream is really got a wonderful model.
Well, thank you all for watching. If you haven't seen the full interview, be sure to go back and watch that, and we'll talk to you all soon. Bye-bye.